This is Dr. Ong. Today I'm going to deliver a presentation on how to manage my team. Actually, my team is a misnomer, maybe. It's your team as well. Yes, everybody's team. So I would like to acknowledge the postgraduate team. Yeah, you see, there's a word team there, right? From Wairavan, Gauri, and the other very hardworking staff of our department. Well, leading and managing a team, there are different, group, different team that people manage of different capacity, objective, and magnitude. Well, big things are like leading a war, to land the Allied troops to France, or on a medium scale, leading a football team in a Champions League. Well, for the Department of Surgery, you and I, we lead different teams. We can lead the department, the division, the unit, the postgrad students, the undergrad student. But pertinent to the talk today, it is about the master student. Yeah, we lead them in their clinical training and also to get their theses completed. Well, many a scenario, like the tennis player, people thought that it is a one-man show, but it is not. Yeah, behind Djokovic, there is a team. He has his personal coach, dietitian, a fitness trainer, psychologist, and so on. To lead to one man's success. Yeah, there are many people behind the scene. Yeah, no one does it alone. Well, I snapshot from the Royal College of Surgeons of England. There is a document on leadership. Yeah, you see, they have a document just on leadership. Yeah, it shows how important it is. Yeah. Well, I highlighted two phrases there. Yeah. Saying that, number one, surgeons should receive leadership and team management training. Okay, statement one. Statement two, all clinician, medical and non-medical, should be taught team working skills as a part of foundation training. Yep, it's foundation. It's the basic. So we all must know. It's basic. Yeah. Well, so you have a role, you and me. Yeah, we have the role. We have a responsibility. Well, what's the impact, of us, doing a good job in leading people? Number one, for the patient, we deal with the patient. It will improve patient's safety. Well, for the student, well, they get training. They get to complete their master program, and they can serve the community. And for ourselves, we'll fulfill our responsibility. To training people, to providing good care to the patient. Well, the bare minimum, we were talking about the bare minimum of being a leader, to lead a team, to manage a team. I would say this slide probably is one of the most important slides. Well, there must be an agreed upon objective. What do we plan to do? We plan to produce a good surgeon. With clinical skill, clinical acumen, able to analyze, study, and evaluate evidence. Well, we must focus on the patients and also the students' interests. And there must be clear leadership. Regular teams meeting. Which is recorded. That's quite important. The word regular is important. Not once every 4 years. There must be an inclusive style of kind of management with a shallow authority gradient, as opposed to shallow authority gradient. There's the other end, the other extreme will be a steep authority gradient. Yeah, so we must have a shallow gradient, so everybody can all work together. Yeah. Culture of openness must be there. Yeah. And there must be an avenue to expose and resolve conflict. Yeah, we don't like conflict. None of us like conflict, but still, yeah, if there's any dispute, yeah, we must put that into the open, yeah, and resolve it. The ability to meet the needs of the staff in training, yep, and a shared understanding of the right and duty to intervene, if necessary. Yep. So this is the bare minimum. Yep. This is a table comparing a team and just a normal group. A team, all the decision, yeah, best made by consensus. Disagreement, examine and resolve. Yeah, there's always will be disagreement. Yeah. Objective, well understood and accepted by all in the team. All members contribute ideas. Yeah, it's important to get everyone involved. Yeah, so they seem to own the project. Yeah, self-examination. Yeah, to be done on a regular basis. Roles are understood by all members of the team. Yeah, and shared leadership is important. Yeah. As the need arises, certain member in the group might be expert in certain thing, so when it comes to that particular aspect, well, we could let the person lead for that particular time and space. So both technical and non-technical skill are required, yep, for us to function well in the team. Well, this is a chart of some dysfunctional behavior. Yep. I won't read them all out. You can pause the presentation to have a look. Yep. So the strength, I'll simply pick two. Yeah, you can pick your own. I would think being focused is a good strength. It's very important. Stay focused on the job. Get it done. Number two, enthusiastic. Yeah, because enthusiastic is infectious. If you are enthusiastic, you can actually infect the other members. You have very high honor, yeah, to infect people. Yeah. Well, the not so good characteristic I would think is perfectionist. Yeah, don't aim for perfection. Yeah, you will probably end up doing nothing because you want to be perfect. Yeah. Next thing is being detached. As if you're a big boss. Yeah, don't touch me. This thing is so simple, you can sort it out all by yourself. So behaving and being looked upon as being detached, it's not very good. Dealing with errors, there are always error, here and there when, along the way as we manage and lead the team. So it's inevitable. So we identify them, manage them, and solve them. So for to do that, communication is important. Yeah, always communicate. Find whichever way, yeah, to communicate. So that will improve the performance of the team. Important for the safety of the patient if you deal with the patient, and important for the student if you're dealing with their work, their thesis progress, and all that thing. Keep talking. Yeah, it's not a choice. Yeah, you have to do that. So another thing, there must be mutual respect. Respect is important. We want people to respect us. We must respect the student as well. Yeah, that's again very important. Yeah, a lot of time we miss that. Yeah, so mutual respect is to be there. Cooperation and effective communication between us and the student, and also for the managerial staff. Yeah, those staff in the office will help us a lot. Yeah. Okay, there are some characteristics of the leader. Yeah, you can pause the presentation to have a look. Some personal quality in setting direction. Yeah, showing people where to go, in delivering service as well. Yeah, it's quite good reminder for all of us. Well, sometimes a change in culture is important. Yeah. Sometimes we are not so used to working, with many people. Yeah. But in a very challenge, stressful environment. So but for us to achieve the objective of the group or of the team, right? So there might be a need for a change of culture. Yeah. To solve the problem, to achieve the common goal. So this is a chart saying that a certain level of stress it must be there. A group that have no stress, very low level of stress, they probably won't achieve anything. Where else, or in the other extreme, if the group is very toxic, with high level of stress, again they won't perform well. So a medium level of stress, which is well managed, well controlled, will keep the group energized and challenged. Yeah. So these are the some example of better way of identifying and resolving problem. You can read from the charts. I will just select a few of them to highlight. For example, leadership require different skill. Yeah, so we need different people of different capability in the group. And the consultant, surgeon, and other experts, they expect to be challenged. Yeah, okay. When they are unsure, sometimes we are not sure. We can ask people to give idea. You must provide that avenue for the team member to do that. Yeah. This is some of the expect. Yep. We can't expect that the group have no conflict. Yeah. So we expect conflict. Yeah. In any group, in any team. Yeah. We expect there must be conflict, right? Yeah. So we must know how to resolve that. Yeah. Something is not right if there's no conflict. Yeah. Okay. Another aspect, if you look on the left hand side, the not so good characteristic will be sometimes you have to get angry, yeah, to get things done. Some people do tell us that, you must act nasty, yeah, to get things done. Is that right? Yeah. I would say most of the time it is not right. So we must recognize and use our emotional intelligence to solve problems. Yep. And to continue, personality is fixed, but behavior can change. Yeah, certain personal characteristic and all of a candidate, of a master student, and so on. It is sort of born with them, maybe. Yeah, but their behavior we can mold them towards a more productive direction. And another characteristic, on the left hand side we say tell the trainee what to do. You want to be successful, do this and that. On the right hand side, maybe a more productive way might be to understand their need, see what they want to achieve, what is their capability and interest, and try to mold and guide towards a favorable outcome. And then for this one, errors are normal. Again, this theme is a recurring thing. We do expect some errors, some mistake here and there, so we need to understand them, bring that into open and resolve them. So that skill is important. And here, proactive supervision. It is very important. Or on the left hand side, we used to see some of our our trainee and a trainer maybe in old days will tell you do as much as you can and let me know if you need me, and then the trainer disappeared. So that is not so healthy. We should be there to offer proactive supervision. Make yourself be there and make the candidate feel that you are there. So I'll just give some real life example from our department. Many years ago, I think more than 5 years ago, I have a candidate A, just say candidate A. His thesis is on a validation of a questionnaire. We just say questionnaire X. which is actually quite complex, quite difficult. And from beginning to end, that candidate A, settle everything from the validation, finding patient, to answer questionnaire, the translation and everything. He done it all by himself, efficiently. So what's the conclusion? We are just being so-called lucky that you have such a candidate who can solve everything. Well, in subsequent years, we have other master students under myself and my team, which is actually being given some easier topics. However, we always face kind of a same problem. There are always static progress report every 6 months when they go for the evaluation. So how do we deal with that? So we learn from all these candidates, and we know that we must form teams. Get a few people, the candidate included, and the supervisor and a few relevant experts, and we form a team. And we have regular meetings, and we involve relevant expert, find the weakest link, where the problems are, and we focus on solving those problems. And we promote mutual respect. I will tell the candidate that if anything goes wrong, 50% of the fault it could be yours, but remember, 50%, the other 50% of the fault, it could be mine. I'm responsible as well. So in that way, you show respect to the candidate. Well, the outcome, happen many times. At the end, it's a win-win situation. So, what kind of candidate is more common? Of course, B. Those that without proper guidance, without working in the team, so they won't progress far. So these are the more common candidates. It's very rare to have a candidate who can solve all the problem by himself or by herself. However, which is the more enjoyable experience in supervising a candidate? Is to be, because you form a team, you all solve the problem to get together. So at the end, it is a very, very enjoyable and fruitful experience. Well, so that team, you like Djokovic's team or any other player's team, everybody will rejoice and enjoy the victory together. Alright, so the above talk that I've given mainly based on the leadership and management of surgical teams from the Royal College of Surgeons of England. So checklist for all of us, just give a checklist. Vision and mission, the objective of that team must be clear. Want to get the thesis done and so on. For example, clear leadership. Members, identify the member of that team with relevance, expertise. We might have a skill and different methods of managing it, resolving conflict, solving a problem, identifying error, rectifying errors. And well, we have all those measurable outcomes like successful completion of the thesis, publication of a paper, and so on. Well, managing a team is a dynamic process. So there's always up and down. We just need to adjust it accordingly. And always tilt the balance and direct the team towards the goals. Well, there's a famous saying, often attributed to Alexander the Great: an army of sheep led by a lion is better than an army of lions led by a sheep. So it's quite relevant to leading a team. So in the Department of Surgery, in any team, in our department, we make everyone a lion. Thank you very much.